What are some different pain management options that you can use while in labor that aren't an epidural? My name's Sydney. I'm a labor and delivery nurse. Follow for more tips and tricks on labor and delivery, postpartum, and newborn care. Now, I want to preface this by saying that not every birthing center or hospital offers all of these options. So check in with your midwife or obstetrician ahead of time to see exactly what will be offered to you. One of the options you can choose is nitrous oxide, and this is also known as laughing gas. So this is a mask that you breathe in. Usually during the contraction, you breathe in and out into the mask, and it helps to kind of make you feel like you've had a couple glasses of wine, makes you feel a little bit lightheaded. It just helps to reduce the pain of the contractions ever so slightly. I will say that this is usually really good just to get you over that last hump of labor. This doesn't work for everyone. Some people love it, other people hate it. It can cause nausea and vomiting, and it can also cause dizziness. So if you're not a huge fan of any of this, then it might not be right for you. Another option that some obstetricians will give you is what's called Morphine Gravol, and this is a shot that goes in your leg and is a mix of morphine, which is a narcotic, a pain medication, and Gravol, which is something to help with nausea, which is called an antiemetic, and this also has an effect to make you sleepy. The reason why we give you the antiemetic with the morphine is because morphine can cause nausea and vomiting. Now, the only thing with this one is we have to give it early in labor and not right before baby is born, because baby will have kind of the effects of the morphine if they're born right within a few hours of administering the morphine. So Morphine and Gravol makes you sleepy. It's also going to make the baby sleepy. It is safe to use, but we want to make sure we time it appropriately and we don't give it to you too far along in your labor and delivery. Something else that you might want to try for pain relief is getting in a tub. So the warm water of a tub or a shower is really, really helpful with those cramps and the back pain that you get during labor. Another option is movement. So getting up onto your hands and knees, leaning on the side of the bed, sitting on a ball. Movement, even if you're exhausted, movement will help you to cope with the pain better. Some people also use tense machines and pressure points on the back to help to alleviate some of that pain during your contractions. Something else is sterile water injections. So this is injections, again, that goes in the lower back, and it's a small amount of sterile water that gets injected into these 4 spots on your lower back. It is thought to help release endorphins and kind of mask some of that pain from the contractions because you're having such sharp pain from the injections in your back. And this has actually been shown to really, really be effective. And I think it's a very easy thing to try. If you don't like it, you don't need to do it again. It lasts about 1 to 2 hours, and then you would need to repeat the process. It's really good for back labor, but not necessarily for if you're having contractions in your front kind of lower abdomen. Now, this one might sound simple, but trust me, it is really effective, and I don't see a lot of my patients doing it, but it is distraction. So keeping your mind busy and your body busy while you're having contractions can actually be a huge game changer. So watch something on TV, get some music going, play a game, do something to distract your brain from the pain that you're feeling. This is another easy technique that you can use. So grab a comb, and some hospitals even have these on hand if you've forgotten yours at home, but grab a comb and put it kind of in the palm of your hand and then just grasp it. And it does that kind of same sensation with the pain that you're feeling here versus the pain you're feeling with your contraction. So you can actually get one in each hand and hold them, squeeze them really, really hard when you're having your contraction to help kind of trick your brain into thinking, oh, there's pain here, but there's pain here as well. Which one should I focus on? And again, it releases those endorphins to help you cope with the pain that you're experiencing. So this is another kind of option that you can use. And then again, heat and cold therapy. So if you have ice packs or heating pads, those are again really good things you can use, especially on your back if you're having a lot of that back labor. Apart from that, the hospital can't really offer you any other pain management techniques other than the epidural. The epidural is a really, really good pain management option, but here are some other things to help get you through the stages of labor that you are feeling until you want to get the epidural, or if you really don't want to get it at all, here are some tricks that you can use.